And I'm going to be chatting this morning with Dr. Leslie Ann Bishop, who is the Senior Medical Officer of the Obstetrics and Gynecology Scarborough Hospital, TRHA, Tobago Regional Health Authority. Good morning, Doctor.
Good morning.
Thanks for joining us this morning. And you know, we are in the middle of Cervical Cancer Awareness Month. What is happening with the TRHA as pertains to cervical cancer awareness?
Right. So cervical cancer, as you know, is the second most common cause of cancer in women in Trinidad and Tobago. And so we are highlighting and making everybody aware of the importance of prevention of cervical cancer. It is one of the few cancers that we can prevent by doing regular pap smears, by getting the HPV vaccine, by following up and getting treatment for early diagnosis of cervical cancer.
All right, so let's roll it back just a little bit, just for the viewers who may not know, what exactly is cervical cancer?
Right. So the cervix is the neck of the womb. It is the tip of the womb which can get cancer, which is a disease which can spread from the cervix and spread to the rest of the body, and if not detected early enough, can cause death. But if detected early, can be treated and can be cured.
Now, you said that it is the second most common type of cancer that affects women in Trinidad and Tobago.
Right, so breast comes first, and then cancer of the cervix. We have about 140 new cases per year, and 97 of those ladies would die per year. Unfortunately, this high death rate is because we perhaps are not detecting it early enough, because ladies are not coming forward early enough to have their pap smears, to get their HPV vaccine, and to have follow-up and treatment.
So what do people look for? What are some of the symptoms to look out for if you may suspect you or a loved one may have cervical cancer? What are some of the things that are, you know, key for us to understand, and like when we see it, we know we have to go to a doctor's office?
Right, okay. So most ladies don't know that they have it. They just get an abnormal pap smear. However, if you have symptoms, for example, abnormal vaginal bleeding, bleeding after intercourse in particular, abnormal vaginal discharge, weight loss, those are the sort of things that should cause you to seek immediate medical attention to determine if that's what your diagnosis is.
And how is it treated, you know, once you are diagnosed and stuff? What is the first step? How do you go about getting treated for it?
Right. So what we try to focus now is prevention, which is detecting the disease in the cervix before it actually becomes cancerous.
Right.
So these ladies will get a pap smear. You get an abnormal pap smear, then you go to the hospital or clinic and you get what is called colposcopy and biopsy, which is looking at the cervix more closely and removing the area. If we see that you do actually have cancer and not any of the precancerous conditions, then you can go on to have further surgery to remove the area of the cervix and the womb and the areas around the womb. Then you may also need to have radiotherapy, which is all available in Trinidad and Tobago. But the most important step really is prevention, which is getting the vaccine from teenagers and from getting pap smears for ladies from 21 to 65.
Now, you mentioned this vaccine. Which vaccine specifically are we talking about, just for the viewers?
Right, it's HPV vaccine. So we know that 90% of ladies who have cervical cancer have been infected by the human papillomavirus, HPV. Now, not HIV, HPV. And now we have a vaccine available, and it's offered in the public sector from boys and girls who are from age 11 up to the age of 26. You can get HPV vaccine to prevent you getting the HPV infection and therefore reduce your risk dramatically of getting cervical cancer.
Are the vaccines, if someone were to go to one of the public institutions, would the vaccines be free, one, and for the older women, would pap smears also be at no cost to the individual?
No, these services are available free of charge.
Right.
Majority of the health centers, you can get the vaccine. You go to the health center, find out which day they do it,
Right.
and you can get the vaccine there. And the pap smears are available at the health centers, at the hospital, at the family planning, most private doctors as well. So it is really important for ladies to get pap smears, and it's once every 3 years. People
Once
who are
every
at
3 years.
higher risk may need it more often, but
Right.
certainly most people once every 3 years.
Now, for the HPV vaccine, you mentioned that males as well get it. How does the HPV spread?
Right. So HPV is spread by sexual activity. So that's why we think if with the men as well are immunized, they can prevent the transmission of it through sexual activity.
And how does the HPV virus affect men, if you could tell us briefly?
Yeah, there are other diseases that are caused by HPV vaccine, which will reduce the risk as well. But the main thing we're looking at is cervical cancer.
Right, right. Well, doctor, I want to thank you for joining us this morning and giving us this very pertinent information, and of course, underlining that the vaccines and the pap smears are free to the public once they go to one of the public institutions. Dr. Leslie Ann Bishop, Senior Medical Officer of the Obstetrics and Gynecology Department of the Scarborough Hospital of the Tobago Regional Health Authority. Thanks for joining us this morning.